Hello, good morning, good afternoon, or good evening, depending on your location. Welcome, welcome to today's program. Welcome to today's program. How are you guys doing? You are welcome to today's program. We shall be discussing kidney disease or diabetic nephropathy. Diabetic nephropathy is what we shall be discussing today. You are welcome. Please indicate where you are watching from. Once you join the program, kindly indicate for me where you are watching from. Welcome, welcome, welcome. Once you join the program, kindly indicate for me where you are watching from. How are you guys? How is your weekend? Kindly indicate where you are watching from. Once you join the program, kindly indicate where you are watching from. I'm waiting for everybody to come online before we start. Let's just get everybody 5-10 minutes. Let everybody come online and then we could start the program. You are welcome. How are you guys? I'm waiting for most people to join the program before we start. Okay. I'm just going through the questions now and see what questions is available. All right. Okay, you are all welcome. We shall be discussing kidney disease or diabetic nephropathy. Diabetic nephropathy is the medical terms of kidney disease for those that are living with diabetics. All right, so that we shall be discussing those two topics today. All right. Let's see what is out there. Sorry about that. Okay. Joe, you are welcome. Where are you watching from? Where are you watching from? Joe, what a diabetic person should consume. Okay, so Joe, have you been watching my videos? Is this your first time? Joe, is this your first time? So we shall be talking about kidney disease. Today we're going to be talking about kidney disease or diabetic nephropathy. Diabetic nephropathy is the medical terms of kidney disease for those living with diabetics. The same way we have neuropathy or retinopathy, okay? All right, so Joe, if this is not your first time, so I believe you've been watching my videos. So the question you asked, if you go to my page, there are a lot of videos on food that you can eat for diabetics and the things you cannot eat as a diabetic. So I would suggest you go to the page. There are all kinds of videos. We've done all kinds of videos on dieting. We've done all kinds of videos on dieting. So I would suggest you go to the page, select the video for dieting, and take your time and watch the video. You will learn more. You will learn more on the things to avoid and the things to eat. Okay, it is explained in details. So I would suggest, because if I'm going to answer that question here, I'm only going to take 1 minute, and 1 minute is not going to answer that question. So I would suggest you go into the page and choose the videos on the topics that is going to tell you on dieting, the things for you to eat as a diabetic and the things for you not to eat as a diabetic. Okay, so if you watch the video and if you watch any video, just anywhere you don't understand on that video, write it down. And then you can come back and say, look, I watched this video. There are certain things I don't understand. Can you explain? Then I'll be able to explain on that particular issue. Okay. Today's topic, we're not talking about dieting. We're talking about a different thing entirely. So go start from the page, go and watch the video. Okay. Anything you don't understand, then you can come back and then we can discuss, take it from there. All right. Because I have a lot of videos on the page about dieting. So that you can learn more from there. All right. But towards the end of the day, towards the end of the program, towards the end of this program, if I have more minutes, I can answer the question, your question. But for now, we're going to pay attention to this specific topic we're discussing now. Towards the end of the program, if there is more time, then I'll be able to squeeze in your question and answer it. All right. So I'm going to make note of your question. I will leave it for now. Towards the end of the program, I'll see if there's more time for me, then I'll answer your question. All right. But go to the page and then you see a lot of videos on dieting. Try to watch it from there. All right, Analu, you're welcome. Watching from Zambia. So let's talk about diabetic nephropathy. Now we have retinopathy. You guys know about diabetic retinopathy. We're talking about eyes. So everything about diabetics, all the complications have their own terms. You all know about neuropathy. Those neuropathy have to do about your diabetic, your feet, your nerve damages, your blood vessel nerve damages. Those are neuropathy. Then when we talk about retinopathy, we're talking about your eyesight, damaging of your eyesight. Okay. Then when we talk about kidney disease, okay, when we talk about kidney disease, we're talking about nephropathy. Nephropathy is a diabetic word for those suffering diabetics. And diabetes can cause you complication in your kidney if you don't take care of your diabetic situation. All right. So that is what we shall be discussing now. All right. So we all know about the dangers of not controlling our sugar levels. We all know about the dangers of not controlling our sugar levels. We all know that. Once you don't control your sugar level, you are inviting trouble to yourself. Once you don't control your sugar level and you're diabetic, you are inviting trouble for yourself. So in today's topic, we shall be discussing what is diabetic nephropathy, which is kidney disease, the causes, the symptoms and stages, treatments, and then the late stage treatments. Prevention, if possible, is what we shall be discussing on this particular topic. Okay. So we all know that diabetic nephropathy or diabetes. Let me just not use that word. Let me just use the simple word that you guys can understand, which is the, kidney disease. Kidney disease is a long-term. Yeah, Nalu, you're welcome. Good afternoon. All right. So we all know that kidney disease is a long-term disease that can affect people that live with diabetics. We all know that. You know, when you start having kidney disease, which is a CKD, is a long-term chronic kidney disease. It occurs when your blood sugar levels, you know, is high, and it damages the person's kidney function. Anything that affects the functions of your kidney is very bad, and that is why I've said it several times that each and every time you go for your A1C test, those quarterly tests, those ones you go every 3 months, make sure you keep an eye on your kidney function and your liver. These are very important organs that you must be checking every 3 months to make sure that your kidney and liver are functioning properly. There is no any attack or damage due to elevation in your sugar level. Okay, so you develop kidney disease, okay, due to the fact that you are having uncontrolled diabetics. And uncontrolled diabetics, which means you are having high glucose levels in your bloodstreams, will now damage your kidneys function, ability to function properly. Okay, and once your kidney is not functioning properly due to high elevations of glucose level in your bloodstreams, that means uncontrolled diabetics, then that becomes a danger and fatal and potent to your life. And I used to use a simple word that kidney is not something you can go and buy in a store. You need somebody to donate a kidney for you, even though you have 2 kidney, okay, and you have a liver. But it's not something that you can go say, okay, if this damage, I can go to the market and buy another one and replace. You need somebody who is willing to take that risk to donate either half of his or her own kidney, or donate one of the kidney, share a kidney with you. All right. So so when you start having kidney problem or liver problem, it becomes so dangerous to your life and the possibility for you to live or die. So that is why you have to make sure as a diabetic, you take control of your sugar level at all times. So Chisha, you are welcome. Before I continue, all right, anybody who wants to uh, join the program live or want to ask their question live can follow this link. I'm going to put a link. You want me to increase my volume? All right, let me see. Just so that. Let me see audio volume. My audio volume is high. My audio volume is high. Okay, so my audio volume is high. Can you hear me now? Shisha, can you hear me? Because my audio volume is to the maximum. Let me know. Can you guys hear me? Is the volume okay? Because my volume is at maximum. I've increased the volume to maximum. Is that okay? Is that high? Can you hear me now? Okay, because I've increased the volume to the maximum. So if you cannot hear me, let me know. If still you guys cannot hear me, let me know. Now, if you want to, I have a new feature here. If you want to ask your question or you have something to share and you want to comment live, you want to join the program live here, you can follow this link. Okay, there's a link I'm going to share now. Okay, this is the link. Open the link in your browser, in your phone, in your laptop. Okay, open the browser or download it and then follow the instruction on how to enter the program. Okay, follow the instruction. Download, open this link on your browser, on your phone, or whatever where you're watching me from. Download it, and then it's going to show you the instruction on how to join the program. So if you want to come, if you have anything to say or want to ask your question live on the video, you can follow this link. First of all, you have to open it in your browser or download it and then follow the instruction to join the program. Then once you request to join the program, I will be able to see you from my end and then bring you in. So those are the links. So have it on your phone. If you decide you want to ask your question in person or if you have anything to say, you can use that link. Okay. That link is going to be only valid for this broadcast. Once the broadcast is ended, you won't be able to join until the next broadcast. All right. So, so I was discussing about kidney disease. Okay. Now we all know that kidney disease is a kind of chronic illness. Okay. The kidney helps. Let's first of all know the functions of the kidney. So for you to know how vital the kidney you have is very important. Okay. Kidney helps to regulate the levels of fluids and salts in the body. Anything that you drink or eat has to be filtered through the kidney. The kidney will take the good ones and keep it, and the bad ones and send it out either through passing urine or passing stools. So whatever you consume or drink must be filtered through the kidney. So kidney helps to regulate the levels of fluids and salts in the body, which is vital in controlling the blood pressure, okay, and protecting any cardiovascular disease. So for you to know how important the kidney is, all right? So once you understand the importance of the kidney and the function of the kidney, that it helps to regulate the levels of fluid and salt in the body, which is also helps to control your blood pressure by protecting any cardiovascular diseases. Those are the importance of kidney. So when you are a diabetic, either you have type 1 or type 2 diabetes or gestational diabetes, your body cannot use or produce insulin as it should. All right. So when you have diabetes, this is what happened. Your body is not able to produce enough insulin, or it's overproducing insulin, but your body doesn't know how to use it. Now, as a result, the high blood sugar levels over time, this high glucose level can damage various organs, including your cardiovascular systems, and then the kidney. The kidney damage that results is known as diabetic nephropathy. So once your kidney is damaged, it is referred as diabetic nephropathy or kidney disease. If it becomes something that is long-term, it becomes chronic, that means CKD. We call it CKD, which is chronic kidney disease. It means it's a long-term kidney disease that you have, that you might need dialysis until you get a replacement of your kidney. All right. So I'm just giving you guys an intro of the importance of your kidney. Okay. Now, diabetic nephropathy is a major cause of long-term kidney disease and end stage of renal disease. Okay. Now, if your kidney disease becomes chronic and you still not find a treatment for it, either by having a surgery to replace it, okay, it becomes an end stage renal disease. Okay, when it becomes an end stage renal disease, okay, the kidney no longer work well enough to meet the needs of your daily lives, and that can lead to kidney failure with potential life-threatening incident. So there are stages of your kidney disease once you are living with diabetics, and that is why I said several times it is important anytime you are doing your A1C level, those every 3 months you have to do your A1C level. I know you guys pay. I know in Africa you have to pay for everything. So make sure, pay that extra, do those tests. Your kidney, your liver are very, very vital to make sure they are functioning properly. There is no any attack or damage to those two organs. Once you do your test, your glucose level is okay, your kidney function is okay, at least you go home, you rest. All right. Then another thing, every year you make sure you go for your eye test. It must be compulsory. Every year you must make sure you go for your eye test to make sure there's no diabetics, there's no sugar in your eye. And if there's any leakage caught early, it could be stopped, it could be delayed so that you don't lose your eyesight. So all those things are necessary for people living with diabetics. All right, they are necessary for people living with diabetics. So now you guys now know what is kidney nephropathy. Okay, it affects people with any type of diabetes because it's a result of due to damage to high blood glucose in your bloodstream. So as long as you are not controlling your sugar level, as I said in several times, when sugar is floating in your bloodstreams, they have no importance. Sugar is not supposed to be flowing around in your bloodstreams. The more they flow around in your bloodstreams, that is when they are causing damages. Because there's an elevation every minute is going high. Every minute is going high and it's floating around in your bloodstream. Those floating around is what causes those damages. Because the essence of insulin or high blood sugar level is that as soon as your sugar level goes high, your brain is going to send a signal to the pancreas, if it is functioning properly, to release insulin. And the excess of that insulin is to move away all those floating excess sugar in your bloodstream into the cells of your body and store them there. And once it's entered into the cells of your body, that is when it's classified as a fuel that your body needs to sustain you and provide you those energy that you need. But once they are still floating on the bloodstream, they cannot be classified as a fuel. Rather, they are potent, causing damages to your health systems. Okay, so high blood glucose levels affect arteries in the body, and kidneys filters blood from those arteries. Okay, as I said, most of the things you drink, okay, eat, have to be filtered through the kidney. It's a process that it has to be filtered. Your kidney select the good ones that your body needs and the bad ones and filter them out. Okay, so high level of albumin in the urine. So, for instance, when you go to test, do your test, okay, they'll test for your albumin levels in the urine. Okay, that's how to find that they test your albumin levels in your urine. So when the kidney are healthy, the urine should contain none of those proteins. There shouldn't be any protein in your urine, known as albumin. So the same way there shouldn't be any sugar in your urine, there shouldn't be any protein in your urine, and there shouldn't be any blood in your urine. I've told you guys about blood in the urine, the excess. There are blood that you can see with your naked eye, and there are blood that you cannot see with your naked eye except under microscope, and you'll be surprised. Okay, you are urinating all the time because you couldn't see blood in your urine, but once they go they say we'll find a trace of blood in your urine, and you'll be surprised. But I couldn't see it. Yes, there are two types. There are the ones you can see with your naked eyes, and there are the ones you cannot see with your under microscope. There shouldn't be sugar in your urine. There shouldn't be protein in your urine, and there shouldn't be any trace of blood in your urine. Once these things occur, then you have to make sure you investigate further to find out what all those things are and stop it. The earlier, the better. So when you have high level of albumin in the urine, okay, then there's a problem. So when the kidney are healthy, the urine should contain none of those proteins known as albumin. That is how, Patrick, you're welcome. Okay. Let's see what you guys have. Okay, so if you while I'm discussing this, if you guys have any question on this particular topic, feel free to ask. On this particular topic I'm discussing, if there's any question you have, feel free to ask your question. Okay. So now a key function of the kidney, Princess Sibeso, you're welcome. So a key function of the kidney is to filter the blood. Okay. A key function of the kidney is to filter the blood. Now, kidney damage affects the ability to do so. Once you have your kidney is damaged, it will not have the ability to filter blood. Okay, the kidney should function at 100% or have a GFR of 100. Okay, so if tests show the GFR is 60% or above, a doctor will not diagnose kidney disease. Okay, so if your test shows that your GFR is 60% or above, all right, a doctor will not diagnose kidney disease. From 15 to 60%, there is a kidney disease. Below 15% indicate kidney failure. I want you guys to understand that, okay? So that when you guys go to your test, look at this number before your doctor, or because, sometimes when you go to your doctor's office and they explain to you, they use a lot of medical terms and you get you confused. So that is why I tend not to use a lot of medical words here. I try to make it simple for you guys to understand. Let me just repeat what I just said. Your GFR, okay, which is your glomerular filtration rate, okay, a kidney should function 100%. Write it down, 100%. Your kidney should function 100% or have a GFR of 100, okay? Now, if you do a test and it shows that your GFR is 60% or above, a doctor will not diagnose kidney disease. I want you guys to write it down the way you can understand. If you do a test of your kidney, now we know that your kidney should function, your GFR should function at 100. Okay? Now, let me just say something here. I'm going to this is what I'm trying to say here, okay? GFR, okay, that is what it is, all right? Glomerular filtration rate is known as GFR. Yeah, Baraka, you're welcome. This is what I'm trying to say, okay? So this is what I'm trying to say, GFR. I hope you guys have seen it, so I'm going to remove it. Now, let's go back again. Let's go back again. Now, your GFR, okay, because they use GFR to know the functionality of your kidney, if you have a kidney disease or not. Now, your kidney should function at 100 or have a GFR of 100. Now, if you go and do a test, all right, and it shows that your GFR is 60% or above, okay, doctor will not diagnose you of any kidney disease. You are okay. From 15 to 60%, from 15 to 60%, okay, there is a kidney disease. From 15 to 60%, there is a kidney disease. But if you are 60% or above, there is no kidney disease. But if your test shows, your GFR shows between 15 and 60%, it indicates you have a kidney disease. Now, if it is below 15%, it shows you are in the territory of kidney failure. So I hope you guys write it the way you can. So when you guys see your test, go and receive your test, and you look at it, you should know whether your kidney is functioning properly or not. Okay, that's why I say write it the way you can understand. You look at a GFR, your kidney should function at 100% or GFR of 100. If your GFR is 60 and above, it means you don't have any kidney problem. But if it is between 50 and 60, it indicates that you have a kidney disease. The doctor are going to find out what type of kidney disease you have. If it is below 15, it indicates you are in the territory of kidney failure. So I hope you guys write it down the way you can understand. All right. So they use GFR in determining the functionality of your kidney for people living with diabetics. Now, when the kidney are healthy, there shouldn't be any protein found in the urine, and that protein is known as albumin. I've posted it there. That protein is known as albumin. There shouldn't be any type of protein found in your urine. Okay? When there's a presence of urine, then it indicates you have a problem. Okay? So I'm trying to make it very simple for you guys to understand. Now, we have something we call ESRD, which is the last stage of kidney disease. Okay? ESRD is the last stage of kidney disease. And before we start going to the causes, let me just say something here. This is what I'm talking about now. ESRD is the end-stage renal disease. Okay, that's what I'm going to talk about now. Okay, this is what I'm going to talk about now. End-stage renal disease, which is ESRD, is the last stage of kidney disease. Okay, diabetic nephropathy is the most frequent cause. What causes the end-stage renal disease is diabetic retinopathy when your kidney is not more functioning properly. Okay, so diabetic nephropathy is the frequent cause of end-stage renal disease in most people. Okay, now, so when you are at this stage, when your kidney function is at this stage, you are approaching the end stage. So the survivor is getting a kidney transplant to survive. There are two ways out: is getting a kidney transplant to survive, or death. Way out. So you have two ways out. One way out is death. The other one is kidney transplant, because you are now at end stage of your renal disease because your kidney cannot function. You are in the territory of kidney failure. So you are now requiring a kidney transplant to save your life. Okay. So managing your blood sugar levels can reduce the risk. Whether a person have type 1 diabetes or type 2 diabetes, they can reduce the risk of diabetic nephropathy. Okay. So what you have to understand, kidney disease is the beginning of diabetic nephropathy. So don't you guys should understand, kidney disease is the beginning of diabetic retinopathy. Diabetic retinopathy is the beginning of your end stage of ESRD. You see the progression. When you are not controlling your sugar level, when you are diabetics and you are not controlling your sugar level, you start attacking your major organs and you develop kidney disease. That is the beginning of, as I said, it's a progression to diabetic nephropathy. Okay, and diabetic nephropathy, if you still not yet control your sugar level, is going to lead you to that end stage renal disease. Okay, so the same way about the retinopathy, losing your eyesight, the same way about the nerve damages, that is the same way diabetic nephropathy about the kidney progress. Okay, so your diabetic nephropathy is the cause of your end stage renal disease, where you'll be needing a kidney transplant to live. All right, so you guys have to understand, kidney disease is the beginning of your diabetic retinopathy. So you guys have to differentiate both too. Okay, so when you have diabetics and you did not control your sugar level, it start damaging those organs. It can cause you to have kidney disease, develop kidney disease. Remember, you have kidney disease because you are not controlling your sugar level. It attacks your organs, liver or kidney, and then you develop kidney disease. Now, if you still not yet control your diabetics, that kidney disease could lead to kidney damage. That kidney damage is what is known as diabetic nephropathy. So I want you guys to differentiate. They are not the same thing. They are different level. Once you are not controlling your diabetics, it's going to lead you to have kidney disease. Now, if you still not yet control your diabetes, it's going to lead you to have kidney damage. That kidney damage is what is called diabetic nephropathy. Now, if you still not yet control your diabetic nephropathy, it's going to lead you to long-term kidney disease called ESRD, which is the end-stage renal disease, where you'll be needing a kidney transplant because you are in the territory of kidney failure. So the only way out is kidney transplant or death. These are the only two ways out. So you could see the way it progresses. So the same thing that happens in your retinopathy, is the same thing that happens in your kidney. There are stages. So once you have diabetics, if you don't control your sugar level all the time, it's going to lead you to have kidney disease. Now, if you still feel unconcerned to control your diabetics, it's going to lead you to have kidney damage. That kidney damage is what is called diabetic nephropathy. Now, if you still not yet control all those messes, it's going to now lead you to that ESRD, which is the end-stage renal disease, where you'll be having kidney failures. The only way out is death or kidney transplant to save your life. Do we understand each other? Do you guys understand it now? Do you guys understand it now? I need a response from you guys. I need somebody to respond. Do you guys understand what I just explained? I need a response. I need a response if you guys understand what I just explained. Who is there? All of you are silent. Princess asked a question. Okay. Princess, Princess, you're supposed to, that question is, you answered is self, that question you answered is self. She's asking a question. Okay. That question you answer, okay, is, I believe you can answer it. I believe you can answer it. Okay. Why I say you can answer it is, let me go back. Hold on. Let me go back to what we just. Mike, I'm seeing I see what you just said to me now. Princess, just hold on. I'm going to answer that question. I'm just looking at Mike. Mike, the picture you sent, I can't. It's not clear. Yeah, can you resend that picture again? I resend it, but make it clear, because the way, and make it a little bit bigger. Let me see. I'm not seeing. There's something that's written underneath it, but I can't see that. I can't see it properly. Okay. All right. Let me see. No, I'm seeing it's on your vein. What I'm seeing here is on the vein. The capillaries there are not showing. I'm seeing the veins here. You know what? Send it on my WhatsApp. Send it up. Send the picture of my WhatsApp. Let me see. And then I'm seeing the capillaries, but I'm not seeing the veins. Send it on my WhatsApp. All right. Okay, Princess, let's go back to your question. Princess asked a question at 96.4 UL creatine or kidney function. Okay, when it comes of creatine, okay, they also it's also part of the test. Princess, I'm answering your question. It's also part of your test in kidney function. All right. Now, when it comes to creatine, it varies between men and women because of the size of their muscle. Yeah, I receive it now. Mike. Let me finish answering Princess' question. Now, when it comes to a creatine, okay, all right, it is part of the test in kidney function, but it varies when it comes between a man and a woman, okay, because of the size of their muscles. Now, for instance, a normal result, say for instance, in terms of men, 61.9 to 61.9 to 114.9 for men in terms of the creatine ratio. And then for women, you're supposed to have between 53 to 97.2 for women. It varies. Creatine level varies in terms of men and women because women have less muscles than men. Okay, so when you have a lower blood creatine level than men, okay, because the size of the muscles in women are smaller compared to men. So men tend to have high level of creatine in them than men. So creatine level varies based on the person's size and muscle mass. Now, in terms of women, when it comes to your creatine level in terms of women, it's supposed to be between 53 to 97. 97. When it comes to a man, is between 61 to about 115. So in terms of your UL in the creatine, you are within the normal range. Okay, you are within the normal range. As I said, when it comes to between a man and a woman, the muscle sizes differs. The body mass, the muscle size is what they take into consideration. So men tend to have a high creatine levels than women. So your creatine levels in terms of the kidney function in 96 is okay. All right, it falls within that parameters. Now, when your creatine levels are higher, okay, when you have high creatine levels, it also indicates kidney problem. Okay, so when your creatine levels are high, okay, it indicates you have underlying illnesses. It indicates you have underlying illnesses, or including infection, or you have a kidney failure. So once you have a kidney disease and your creatine level is too high, not necessarily you have a bad kidney problem. It could be an infection, okay, that can be cured with antibiotics. So that is why when you have a kidney disease, before it gets to that stage of kidney nephropathy, which is the kidney damage, doctors are going to run a test to find out what type of kidney disease you have. Is it an infection in the kidney that could be cured with antibiotics, or sometimes they might even leave it. There are some infections that are healthy that doctor will say, no, forget it. It's going to just wash your kidney, is going to filter it away. All right. So, but when you have a high creatine levels, it can indicate two things: underlying health conditions, including kidney infections or kidney failure. So doctors typically consider high creatine levels to be above 1.2 milligrams per deciliter. For men, it's 1.0 milligram per deciliter. So in terms of your 96.4 UR creatine levels, you're within the normal level. So it does not indicate that you have a kidney problem or kidney infections. Remember, I said men and women have different creatine levels ratio, because women tend to have less muscle mass than men. So men tend to have high level of creatine than women. So yours fall within 96.4 is within the normal level. All right. Princess, have I answered your question? Princess, did you understand what I just said? All right. So I'm changing my, what am I trying to discuss now? So now let's go back to what we were discussing before. Now, how can How can you reduce the risk of diabetic nephropathy? How can you reduce the risk of you having a kidney damage? Okay. How can you reduce the risk of you having kidney damage, which is the same thing as diabetic nephropathy? One is monitoring your glucose levels and keeping them within the target range. We are talking about how you can avoid kidney damage. How can you avoid kidney damage? One is monitoring your blood glucose levels and keeping them at the target range all the time. I've been saying all this. I've been saying it. Okay. I've been saying all the time. People think that when they control their sugar level for 2 weeks, 1 month, they say they are okay. Doctor, I don't want to drink medication anymore. Okay. That is not controlling your sugar level. Controlling your sugar level has to be constant, day by day, minute by minute, hour by hour. It's not something you control your sugar level 1 day, 2 days, 1 week, and you say you're okay. It has to be day by day, minute by minute, hour by hour for a longer period of time. That is what is regarded as controlling your sugar level. So when people say they control their sugar level for 1 week, 2 weeks, and then they're okay, you've not done anything. You must control your sugar level at all times to avoid all these complications. So avoiding kidney damage, the first thing you have to do is monitoring your blood glucose levels and make sure you are keeping them within the target range. Number 2 is having a healthy diet that is low in sugar and salt. Okay, once you're a diabetic, stay away from salt. Stay away from salt and sugar, because that can also complicate the issue for you to have a high blood pressure. So having a healthy diet is very important. Okay, that are low or no sugar and salt. 3 is getting regular exercises. Exercises is very important. That is I'm discussing ways you can avoid kidney damage. Okay, or reduce the risk of kidney damage. Remember, I said when you have kidney disease, it's different from kidney damage. You have a kidney disease, but it's not yet damaged, it's still functioning properly. It might be a minor infection or major infection. So controlling your sugar level at the beginning is one. If you don't control your sugar level at the beginning, it's going to lead you to have kidney disease. And if you still not yet control your sugar level, it's going to have you to have this kidney damage, which is what we call diabetic nephropathy. So how can you reduce the risk of having kidney damage? Regular exercise, eating healthy food with no sugar, no salt, and monitoring your blood glucose level and make sure you are keeping your blood glucose level within the target range. And then following your treatment plan, which may include use of insulin or other medications. You must follow your doctor's treatment plan, which include medications, and then also maintaining a healthy weight. All right, Marilyn, you're welcome. So maintaining a healthy weight, okay, these are some of the ways. These are some of the ways you can reduce the risk of having kidney damage. All right, I'm going to repeat it one more time. Which are the ways for you to reduce the risk of having kidney damage? One is monitoring your blood glucose levels and keeping them within a target range all the time. 2 is eating a healthy diet. You must eat healthy and reduce and make sure there's no sugar or salt. And I've emphasized before, if you guys are preparing food for a family, do not just put, like there's some family when you go to, when they are preparing food, they put salt in the pot for everyone to eat. No. Gone are the days. Now they don't do it. Now they don't do it this anymore. Things have changed. Prepare your food without salt. Then, because everybody might have underlying illnesses, there are some people that don't like salt in their food. Prepare your food at all times without salt. And then when you are serving them on the dinner table, put salt on the table. Let everybody take what they want. Some don't need salt in their food at all. Some need a slight salt. Okay, so having a healthy diet that has no sugar and no salt, and again, getting regular exercise is very important, and then following a treatment plan as prescribed by your doctor, which may include medications and insulin, and again, reducing your weight is very important. These are some of the ways you have to reduce the risk of kidney disease. All right, now let's talk about the causes. What are the causes of damage to kidney? What causes kidney damage? Let's discuss the causes of kidney damage, why you have kidney damage. Well, you guys know one. One of it is, if you don't control your sugar level as a diabetic, it's going to cause you to have a kidney damage. There are some other factors again that can cause you to have kidney damage. So we're going to look at all those factors that can also cause you to have kidney damage. Okay, kidney damage. Okay, when you have a kidney disease that result in kidney damage, it puts stress on the vital organs and prevent them from working properly. The functionality of your kidney and even liver is going to be affected. Other organs are going to be affected because kidney plays a vital role in connecting other organs to function properly. Now, when you have kidney damage, this what happens. Now, the body starts to lose protein through urine. Okay, when you have kidney damage, this is what happens in the sequence. Anytime you start having kidney damage, the body starts to lose protein through urine. That is why there shouldn't be any presence of protein in your urine. So when you go for a test and they find protein in the urine, it means there's a problem in your kidney. Okay, so when you have a kidney damage, the first thing that occurs is that the body starts to lose protein through urine. Okay, now the second thing is that the kidney cannot remove waste product from the blood. Remember, your kidney serves as a filtration organ that filters the good and the bad, keep the good and the filter the bad out. So when your kidney is not functioning properly, the kidney cannot remove the waste product from the blood anymore. Now, the third one is that the kidney cannot maintain healthy fluid levels in the body. That is why you see when people that have serious kidney damage, you see that their body starts swelling up. Their leg, their hand, their feet, their body, their face starts swelling up because now the kidney cannot maintain healthy fluid levels. So the kidney is not functioning. So these are the sequence. You see people with kidney disease, when it becomes that end stage, you see them swallowing up because your kidney is not able to maintain a healthy fluid levels in your body. So these are the three things that happens when you have a kidney problem. Let me see what Marilyn says. Mary, I use salt, no sugar, I have cramps. So I use mustard in warm water. You're welcome. Haji, you're welcome. All right, so these are the causes of what happens when you have kidney damage. Okay, this is what happens when you have kidney damage. First of all, the body start to lose protein through urine, and then the kidney cannot remove waste product from the blood, and then again the kidney cannot maintain a healthy fluid in the body. These are the three things that happen when when your kidney disease have not developed to kidney damage. Okay. Now this kidney damage develops slowly. Okay, it's something that develops slowly. All right. That is why do not neglect any slightest symptom that you have. Do not neglect any slightest symptom that you have because it develops slowly. Any symptom that you have or you find out during your A1C test, make sure you consult your doctor. Okay, so once you are managing your blood glucose level very well, you are less likely to have diabetic nephropathy or kidney damage. Once you are managing your your diabetics properly, you are less likely to have these complications. They are all complications. Okay, high blood glucose level increase the risk of high blood pressure, kidney damage, okay, damage of blood vessels and nerves, you have to avoid all these complications. It all starts up with managing your blood glucose levels. I say diabetics. Now let's look at other risk factors. What can cause you to have kidney damage? Okay, there are also other risk factors that can cause you to have kidney damage. One is smoking. Okay, smoking can also damage your kidney. Okay, between smoking and then high level of inflammations. Okay, can also, because once you are a chain smoker, you smoke a lot. Anytime you smoke, it inflames all those nerves, the arteries, the blood vessels. Okay, remember those kidneys, there are a lot of nerves, blood vessels, arteries connecting them. So anything that inflames those nerves and arteries also causes damage to the kidney, because now there might not be blood flowing to those areas, or it might be hampered. So blood are not more flowing frequently to those areas. So smoking can also be a risk factor of you having a kidney damage. And that is why I say somebody that has a diabetes, if you're a smoker, you have to stop. Okay. Smoking is a link. There's a link that causes you to have kidney damage due to the inflammation. All right. Now, age plays a vital role. Okay. Age also plays a vital role. If you are in the range of 60 and above, okay, you stand a high risk of having kidney disease. Age also plays a vital role. In the people in the age of 60 and above stand a high risk of having kidney disease. Now, sex also plays it's a risk factor of you having a kidney disease. This condition is more common in men than in women. Sex. Okay? Sex is also a risk factor that is one risk factor for you to have kidney disease, and it's more in men than in women. Now, health conditions like obesity or any underlying illnesses, high blood pressure, cholesterol issues can also open you up of kidney disease. So these are some of the risk factors that can contribute to you having this kidney disease or kidney damages. Now let's look at the symptoms. Let's look at the symptoms and then the stages. Let's look at the symptoms in terms of the early stages of diabetic neuropathy, or early stage of kidney damage. Okay, we have the early stage, we have the mild stage, and we have the end stage. So there are three stages of kidney damages. In the early stage of diabetic nephropathy, a person may not notice any symptoms. Normally, like I said, even when you're diabetics, okay, in the early stages, you don't notice any symptoms because they are silent, they are mild. The same thing happens to a kidney. In the early stage of a kidney disease, you might not notice any symptoms. Okay, changes in the blood pressure and the fluid balance in the body may already be present, and you might not even notice it. Over time, the waste product can build up in the blood, leading to symptoms. As I said before, when you see people that have kidney problems, all of a sudden you start seeing them swelling up because the kidney cannot remove or maintain the fluid levels in your body. So now your body keeps swelling up. All right. So in the early stages, you might not even notice those symptoms, and maybe the fluid levels in your body has increased. I might not even notice it. Okay. So stages. Okay. The stages of kidney depending on the GFR, which also represent the percentage of effective kidney functions, differs from individuals to individuals. All right. So now, stage one. Let's look at stage one. We have 5 stages. Let's look at stage one. Okay. If you have kidney disease and you fall in stage one, okay, stage one kidney damage present, in stage one, there's a kidney damage present, but normal kidney functions and a GFR of 90% or above. Okay, so in stage one, you might have a slight kidney damage or kidney disease present, but still your kidney function is above 90%. All right. So that one, doctor might not have any, you just overlook it. Okay, they are in stage 1, the kidney damage present, but you still have your GFR above 90%. Remember, your GFR must be 100, but your GFR is above 90%, but there's a presence of kidney damage. That is stage 1. That is why I say when you start having those in that stage 1, the earlier the better to correct it, or to delay it, or to cure it. Now, when you go to stage 2, okay, kidney damage with some loss functions. Okay, remember in stage 1, there's a kidney damage, but your GFR is above 90%. There is no loss in function. Your kidney is still functioning properly in stage 1. Now, in stage 2, your kidney damage is there, but now it has some loss in function. There are certain things that are missing. It's not functioning at full capacity. So the GFR is 60 to 89%. That is stage 2. It means there's a kidney damage. You are now losing some functions of your kidney, and that's the range is 60 to 89%. Okay, that is stage 2. Now, in stage 3, it becomes mild to severe loss of function. When you start getting to stage 3, that is when it becomes mild and severe loss of functions, and your GFR is between 30 to 59%. That is when you start feeling the effect of kidney damage. Okay, because your GFR is 30 to 59%. Now, when you go to stage 4, that is when it becomes severe loss of function. That is when it becomes severe loss of functions. Your GFR is 15 to 29%. And then the last stage is stage 5, which is the kidney failure, which is your GFR is below 15%. So we have 5 stages. You know, even when you do your test, you could see, like when I do my test, you could see my classification on what stage I am. I'm always on stage 1. I'm always on stage 1. I have never gone to stage 2. Okay, so you see where they classify you. Your kidney function, the rate, and everything is stated there. I'm always on stage 1. Okay, kidney damage present, but normal kidney function, is above 90%. So you still have stage 5. So you have 5 stages, okay, in terms of your kidney function. I don't know if I could, let me see. All right, let's see what is going to happen here. This is stage 1. I'm going to put them stage by stage. And this is stage 2. This is stage 3. All right. So those are the stages. All right. So those are the stages. Then we're going to talk about the symptoms of kidney damage. We're going to now discuss about the symptoms of kidney damage. And as I was saying, all right, when you are preparing your food, I've said it several times, kidney serves as a filtration organ. It filters the bad and the good from your blood. Whatever you eat and drink has to be filtered from your kidney. Now, I've said it earlier on when we started this program, and all the time, that gone are the days when people are preparing food and they put salt in the big bowl, because not these things have changed. Now, when you're preparing food for the family or for guests, you do not put salt in those pots. Cook your food without salt. Okay? Cook your food without salt. And then when you are dishing or serving on the dinner table, you put your salt on a small container, leave it on the table, let everybody take whatever they want. Because individuals has underlying illnesses. There are people that don't need salt in their food because of the underlying illnesses, their health status. And there are people that like salt. So when you are serving your food on the dining table, put salt on the table, let everybody take whatever they want. Okay? If you're a diabetic, okay, stay away from salt. Okay, if you're diabetic, stay away. The way you are staying away from sugar, stay away from salt because of you not developing being hypertensive. Okay, stay away from salt. If you can do without salt, the better. The same thing in terms of smoking. If you're diabetic, stay away from smoking. Okay, if you can do without smoking, the better. So salt is not good for you if you're diabetic. Especially, it might lead you to be hypertensive. You might even be hypertensive. I don't even know that you're hypertensive, because hypertensive, the symptoms are silent, mild. Okay, you are diabetic and at the same time hypertensive, and you even know that you have hypertension until you go to the hospital and they tell you you're hypertensive. And that is why you have to minimize your salt intake. Okay, if you're diabetics, stay away from salt, whether small or not, small or big or large, stay away from salt. It is not good for you. Okay, it is not good for you as a diabetics. The way you are running away from sugar and counting your carbs, the same thing applies to salt. Stay away from salt. It doesn't matter whether you are taking small or big or whatever, stay away from salt to avoid other complications that might arise from it, because there are other complications that can come in due to the consumption of salt. So stay away from salt. It is not good for you. The way you are staying away from sugar, stay away from it. Okay, so that is it. For those that have asked me questions about salt, that's all I have to say. So let's go to the symptoms of kidney damage. Let's go to the symptoms of kidney damage. Are you guys hearing me? Are you guys hearing what I'm saying? Are you guys hearing me? Everybody's quiet. Everybody's quiet. I need to know who. I need to make sure you guys are hearing, understood what I just said. Can somebody confirm? I need somebody to confirm if you guys heard what I just said, so that I don't want to be as if I'm talking to myself. Okay, are you guys following? All right. So we're going to talk about the symptoms of kidney damage. Remember, I say in the early stages, a person may not notice any symptoms. If you're having a kidney damage in the early stages, you might not notice any symptoms. Okay, at stage 4, like those stages that I shared with you guys, you can only start noticing symptoms at stage 4 or 5. Okay, at stage 4 or 5 is when you start feeling unwell and experiencing some of the symptoms. Okay, and what are those symptoms? Number 1 is swollen ankles, feet, lower legs, or hands due to water retention. Okay, number 1 symptoms of kidney damage is swollen ankles, feet, lower legs, or hands due to water retention. Remember, when you have a kidney damage, your kidney is not able to maintain a healthy fluid levels in your body. Now the fluids keep building up. That is why I see people start swollen, their stomach swell up, their feet, everything starts swollen, because the kidney is not now unable to maintain a healthy fluid levels in your body, and that is why you have swollen ankles, feet, lower legs, hands due to water retention. All right. Number 2 symptoms is dark urine due to blood in the urine. Okay, dark urine due to blood in the urine. Okay. Okay. You may experience dark urine due to blood in the urine. Okay, that's number 2. Number 3 is shortness of breath. Number 3 is shortness of breath. Number 3 is shortness of breath as the symptoms of kidney damage. Number 4 is fatigue due to lack of oxygen in the blood. Number 4 is fatigue due to lack of oxygen in the blood. I've told you guys, oxygen is transported through the blood to the brain and all over the body. Okay, so if you are feeling fatigue due to lack of oxygen in the blood, is one symptoms of damaged kidney. Number 5 is nausea or vomiting. Number 5 is nausea or vomiting. Number 6 is a metallic taste in the mouth. A metallic taste in the mouth is number 6. Okay, these are some of the complications of kidney damage. Now, when it becomes end stage, late end stage, okay, remember we talk about the end stage ESRD. The complication of end stage kidney disease or kidney damage include cardiovascular disease. That is what they refer to as end stage. When it has now gone to cardiovascular disease, you are approaching your death. That is the complication of late stage kidney damage disease, cardiovascular disease. Okay, so now since you guys now know the symptoms, let's look at the treatment. The treatment, okay, the earlier the better. Once you have any okay, when you have any symptoms, make sure you start treating that symptom at the early stage before it goes into the major symptoms. Now, when you do your kidney function test, okay, one thing you have to understand, remember I said there shouldn't be a protein found in your urine. Okay, there shouldn't be proteins, blood, or sugar found in your urine. We are talking about kidney. In terms of kidney, there shouldn't be a protein found in your urine. Okay, now, even though they found urine, I mean, even though they found proteins in your urine, that does not necessarily mean that you have kidney disease. Even though they found protein in your kidney, I mean, protein in your urine, that does not mean you have kidney disease. It could be due to UTI, urinary tract infection. It could be urinary tract UTI infection. So even though there's a protein in urine, that does not mean that, oh, it's a kidney disease. It could be other infections. Okay. So let's look at the treatment. The treatment can delay or prevent onset of diabetic further kidney damage. So treatment of kidney problems or kidney disease, doctor look at it in two ways. Okay, it depends on the stage of your kidney disease. Before doctors can fashion out which way to treat you, they will send you to a specialist. Now, the stage of your kidney will depend what is the purpose of those treatment. Is it to delay or to prevent further kidney damage? So it depends on the stage. Doctor will say, okay, now we can delay or prevent other kidney damage, and then they fashion out a plan for you. So to maintain, the aim of the treatment is to maintain control your blood glucose levels at all time. So one, in fashion out a treatment for kidney damage, they look at the stage of your kidney problem to know, okay, if it's an early stage, okay, now we can delay or stop further damage. If it's something in the 4 or 5 range stages, then it's a severe one that you might be needing kidney transplant, that you have to go through dialysis. Okay, so the stage of your kidney problem will determine the type of treatment being fashioned out for you. So the aim of the treatment is to make sure as a diabetic, you have your blood sugar target all the time. Is maintaining your sugar level target all the time. Okay, blood glucose level and then your blood pressure must be maintained at a regular target range. Okay, now doctor might also give you some medications depending if it's an infection to treat it. So your stages of your kidney problem will determine the type of treatment doctors are going to fashion out for you. That is very important. There are some drugs they might give you. Also, as I said, stay away from salt, stay away from sugar. Maintaining adequate sugar level is very important at all times, and also make sure that your blood pressure is good at all times. So, and also doctor is going to back you up with some medications. There are some medications they might give you, but as I said, it depends on the stage of your kidney disease. If you're on stage 4, stage 5, there's no point of giving you medications. What you need that time is, what you need that time is, so I'm going to step away a little bit. My tea is getting cold. Step get it for my tea. All right. So if you're on stage 4, stage 5, okay, of kidney problem, giving you drug treatment is of no use, because what you need is a transplant. So the stage of your kidney problem will determine the type of treatment to start with you. So, but the most important thing is dietary changes are very important. Okay, apart from the medications they'll give you, okay, dietary changes are very important for people living with kidney disease. Okay, water is very important. Okay, so if you have kidney problem in the stage of stage 4 or stage 5, you might not be drinking a lot of water, because too much water or fluid may increase the risk of swelling and high blood pressure, because your kidney is not able to maintain or to maintain fluid levels in your body. So you won't be drinking a lot of water in order not to increase your body from swelling. You are trying to get rid of those excess water, so you're going to reduce your intake of water. So dietary changes are very important. Now, sodium, as I said about salt, you're going to stay away from salt. Whether small or minor, you're going to stay away from salt. Protein, a person with kidney disease, protein can cause waste to build up in the blood, putting extra pressure on the kidney. So you have to avoid food that contains a lot of proteins because already you're having problem with your kidney. Now, phosphorus and potassium, okay? You have to avoid food that contains a lot of phosphorus and potassium, okay? These are things in terms of your dietary changes. So people that have kidney damages will avoid food that contains a lot of phosphorus, food that contains potassium, food that contains protein, sodium, and you are not going to drink a lot of water anymore because your kidney is not able to maintain fluid levels in your body. So drinking a lot of water is going to worsen the situation. So those falls under the category of dietary changes. So there are a lot of things you have to do, and then managing your sugar levels at all times is very important. But make sure that it does not go to stage 4, stage 5. At stage 1, stage 2, you stand chances of stopping it, delaying it, or even curing it permanently. But when it gets to stage 4, stage 5, then you have to have a lot of dietary changes whereby you're not going to drink a lot of water anymore, avoid food with proteins, phosphorus and potassium, and then salt. Okay? So when it becomes the late stage treatment, that's when you need dialysis. At the late stage, that is when you need dialysis. All right, that is when you start needing dialysis to survive. Okay, so it is very important. It is very important you know of all those things. I don't know. Someone is asking me something about itching of feet. I don't understand what you mean by itching of feet. That is why I did not bother. I don't understand what you mean itching of feet. Okay, so that's why I didn't bother looking at it. Okay, I don't understand what you mean by itching of feet. All right, so now, do you guys have any question on this topic we're discussing today, kidney disease? Do we have any question on this particular topic, kidney disease? Let me see. We're almost there. In the next 10 minutes, we should be done. In the next 10 minutes, I should be done with this program. Do we have any question on this particular topic? Too many questions here. I'll deal with it later. Do we have any question? I need I'm going to answer your questions when I'm done. All right. I've answered that question. Okay, let's we have a scammer here. We have a scammer here using different names, and This says scammer call herself Lasheen, an African using a woman picture to scam people. Good luck. Bob Senesi, you're welcome. Let me go to I thought potassium supplement can balance sodium and is therefore not that bad after all. Bob asked a question, a very interesting question. All right. Bob says, I thought a potassium supplement can balance sodium and is therefore not that bad after all. Okay, let's go. Let me answer that question. That's an interesting question. I remember I told you guys also check when you're doing your test, check your potassium level. Okay, potassium level is very important. Now, in terms of supplements, if you guys remember, when I was in one of, I think a couple of my videos I did, there's something we call CBC, complete blood count. When you are doing your test, also requires for CBC test. Now, in terms of, I'm going to try to answer your question about potassium. Now, if you do your CBC test, your complete blood count test, it's going to tell you everything that you need. Okay, your vitamins. Okay, Riaz, thank you very much. Now, if you do your CBC blood test or you do your potassium test and it shows normal, okay, but when I'm answering your question, it shows normal. You don't need potassium supplement anymore. Okay, if you do your potassium test and it shows normal, you don't need potassium supplement anymore. If you do your CBC blood count and you see you're not lacking in any of these vitamins and minerals, you don't need them. Remember, once your potassium is normal, you don't need to go and buy supplement and keep taking potassium again because it shows your potassium is normal. All right. So you can only, if for instance, you do your CBC blood count and says your vitamin D is abnormal, it means you have to make sure you bring your vitamin D level to be normal. Then you can go and buy a supplement specifically for vitamin D to bring your vitamin D level to normal. The same thing to potassium. Okay, so potassium, when we talk about in dietary changes in people with kidney disease, okay, when we talk about potassium in dietary changes on people with kidney disease, not kidney damage. Remember, there's a difference between kidney disease and kidney damage. At kidney damage, you have 5 different stages. You are stage 4 or 5. That is when it becomes severe. When you are stage 4 or 5, remember we have the functions of kidney. There are 3 things happens when you have a kidney damage. There are 3 things that happens when you have a kidney damage. We'll talk about it. Okay. Sorry, I'm under the code. There are 3 things that happens when you have a kidney damage. 1, the body starts to lose protein through urine. That is why I've said before, anytime you go for urine test, there shouldn't be any protein in your urine. When there's a presence of protein in your urine, there's a problem. Doctor have to go investigate to know why there's a presence of protein in your urine. The same thing with blood, the same thing with sugar. Okay. Now, when you have a kidney damage, now your body starts to lose protein. That is when you start finding protein in your urine. 1. 2, the kidney cannot remove waste product from the blood. 3, the kidney cannot maintain healthy fluid levels in your body. That is why you see your body starts swelling up. That's when you have kidney damage. Now, these are the things that happen when you have kidney damage. And they are trying to tell you, okay, and they are trying to tell you in the treatment aspect of it, if your body is not able to maintain a fluid level due to kidney damage, they ask you not to be drinking water anymore a lot, because your kidney is not functioning to retain fluid level in your body. That is why you keep swelling up. So if you have a kidney damage and you keep drinking a lot of water, you are worsening the situation because your kidney is not functioning to maintain a fluid level that your body needs. So that a lot of water is going to make it to be swelling up anymore. We're talking about treatment. Your kidney is not functioning, it's not retaining fluid level. That is why your body swells, because fluid is not building up in your body. So you can't be drinking a lot of water anymore, because the more water you drink, the more you're worsening the situation. That is one. That is on the dietary changes on how to mitigate this problem. And then number two is sodium. Okay? Sodium is going to raise your blood pressure because you're having kidney problem. So if you have a kidney problem, and as soon as you have a kidney problem, it's going to make you have a high blood pressure. So why would you be eating something that contains salt? They are trying to tell you, due to your kidney problem that may affect your blood pressure, now stay away from salt. Now, protein. Remember, when you have a kidney damage, your body will start losing proteins through urine. There shouldn't be any protein found in your urine. But because you have a kidney damage now, your body will start losing protein through the urine. And they are trying to tell you, since you have a kidney damage, stay away from food that contain protein. Because protein, if you eat food that contains protein, when you know you have a kidney problem, it's going to build up waste in the blood. It's going to build up waste in the blood, putting extra pressure on the kidney. So you have to stay away from food that contain protein. Now, in terms of potassium, okay, that's what I'm answering your question now, Bob, in terms of potassium, okay? People with kidney problem, kidney damage, okay, can have a high level of potassium than is helpful. So, which can affect nerve cells. So, because of your kidney damage, you cannot be eating food that contains potassium because you're going to have a high level of potassium. So that's why they say when you have a kidney damage, don't eat any food that contains potassium, because the more potassium you eat is going to build up higher, which is going to even damage the kidney more. So, Bob, I believe my explanation is how safe is intake of areas. Thank you. Okay. Bob, I believe I've answered your question. In terms of when you have a kidney damage, okay, that rule does not apply. In terms of potassium, balancing sodium, okay, when you have a kidney damage, that equation does not apply, because you have to stay away from potassium. You have to stay away from salt. These two things, once you have kidney damage, you have to stay away from those two things because they are going to worsen the situation. That is the dietary changes. You're not going to eat anything that contains salt. You're not going to eat anything that contains potassium. It does not balance each other when you have kidney damage, because these are the dietary changes you have to avoid when your kidney is not functioning properly, because you are almost at the end stage. What you need is a transplant. At this stage, you are waiting for somebody to donate a kidney for you to live. So you shouldn't be eating things that are going to worsen the kidney that you have in your body, because remember, you'll be under dialysis. So that is why they are making these dietary changes at that particular stage 4 and stage 5. So thought of supplement balancing sodium and salt, it does not apply when you are at stage 4 and stage 5, because at stage 4, stage 5, you are looking for transplant. So With the kidney that you have that is not functioning properly below 15%, you don't want anything that is going to worsen the situation. That is why they're making dietary changes. Stay away from something that contain protein. Stay away from something that contain potassium, because it's going to worsen the situation more. So it has nothing to do at stage 4, stage 5. Balancing each other does not apply, because you are waiting for a transplant and you don't want anything that is going to worsen the situation already, because eating things that contain potassium and protein and salt is going to make it even worse. That is the dietary changes that you have to do. Okay, so let's go to how safe is intake of this. Your salt and no salt. Okay, if you're diabetic, stay away from salt. I'm not going to give you an encouragement to go and look for candy salt, Malaysian salt, Botswana salt, or Kenyan salt. Sorry. If you're diabetic, stay away from salt. Stay away from salt. Stay away. If you have blood pressure, hypertensive, stay away from salt. People are looking for somebody to qualify them to go and give them reason to go and eat salt. Like somebody was asking me yesterday, is it up for yesterday, or about skim milk, about milk? What, people are looking for reason to go and eat those things they ask them to stay away. You are a diabetic. They ask you to stay away from anything that contains sugar. Stay away from it. They ask you to control your carbohydrate intake. Control your carbohydrate intake. So don't look for any excuse for someone to say, "Oh, the doctor said I can go." And no, sorry, I'm not gonna. Whether it is any name you call it, salt is salt. Whether it is Jamaican salt, Nigerian salt, Kenyan salt, salt is salt. Stay away from salt. Simple and eat. It doesn't matter what kind of salt it is. Stay away from it. If you're diabetic and hypertensive, stay away from all those things. You have a choice to make. You want to live, you want to die, go ahead. All right. So I have seen a lot. People have come to me. You tell them to stay away from this. They will go and come back. They try to use something. Doctor, what about this? They are trying for you to tell them, say yes. Then they'll go and be eating it. They'll try to find something to add to that thing for you to give them go ahead and drink. There's no shortcut in managing your diabetes or your hypertensive situation or your kidney problem. If you have a diabetes, stay away from those things they ask you to stay away. Don't come to me and tell me, doctor, you say don't eat white rice. What about Malawian rice? Can I eat Malawian rice? Is rice. Why are you telling me because I use white rice? Then you come back and tell me, what about Malawian rice? What I tell you, rice is rice. Stay away from white rice. Eat brown rice in moderation. So now you're asking me, what about Himalayan salt? My friend, salt is salt. It doesn't matter whether you call it Himalayan salt, you call it Jamaican salt, you call it Kenyan salt. Salt is salt. If you're diabetic and hypertensive, stay away from salt. Simple and short. Do not quantify it with any other words. Those that are asking me, oh, can I take skim milk? Can I take half milk? My friend, milk is milk. It doesn't matter whether you call it skim milk, this and that. Milk is milk. It's going to still give you the same problem with your diabetic situation. And I've challenged anybody. I say, okay, I told you stay away from milk, and you come back and tell me, oh, what about there's one name they use, but at the end of the day, it's milk. All they are looking for is for you to tell them, okay, go ahead, it's good. Then they go and buy it. I mean, everybody, oh no, one doctor told me that I can use it. No, my friend, salt is salt. It doesn't matter whatever name you call it, it's salt. Stay away from salt. The same thing about milk. Whether you call it Jamaican milk, whether you call it South African milk, whether you call it Nigerian milk, whether you call it Ghanaian milk, is milk. There is no milk that does not contain high carbohydrate, high calories, and sugar in it. So don't come and tell me, because I told you not to drink Kenyan milk, you come back and tell me, what about South African milk? So you want me to say, okay, yes, go for South Africa? No, my friend, milk is milk. Stay away from milk. So the same thing applies to salt. Stop. I don't want people coming to try to use a word What about the Himalayan salt? My friend, salt is salt. The same salt is going to give you the same problem. If you're hypertensive, if you're diabetic, stay away from those things if you want to live. If you don't want to live, go ahead and consume them. Because at the end of the day, another man is going to raise your wife and raise your kids. You are going to be 6 feet below the ground, and somebody's going to be enjoying your wife and abusing your kids. The same thing applies to your husband. At the end of the day, you're going to be below 6 feet, and somebody's going to be enjoying your husband because you don't want to listen simple advice. So stay away from all those things. Stay away from whatever name it calls. Salt is, whatever you call it, whatever name, salt is salt. It doesn't matter whether you put it another name there, salt is salt. Especially if you're diabetics and if you're hypertensive, stay away from all those things. It does not help. Okay? So I've said enough on all those things. You know, you when it comes to diabetes and all these complications, it's an individual choice. You have to make the choice whether to live or whether to die. I choose to live, and that is why I have to follow that strict rule. I have to sacrifice all my favorite food in order to live. If you have to make a choice as a diabetic, as a hypertensive patient, do I want to live or do I want to die? It's a choice. It's two simple answer. If you want to die, go ahead and eat whatever you want to eat. At the end of the day, you have to pay. You are the one to pay the ultimate price. Hence, I'm going to say to you goodbye, and then you move on. We separate. You belong to the land of the dead. We belong to the land of the living. We have nothing in common. Until we meet again in the land of the dead, then we unite. But it's a choice you guys have to make, whether you want to live or you want to die. There's no shortcut in managing diabetics. There's no shortcut in managing kidney disease. Kidney disease have stages. The things they ask you to avoid it, avoid it. The things they ask you to eat, stay on that lane. That is as simple as ABCD. Okay? So it's a choice you guys have to make. So let's another question. Do you have another question? Let's get into another question. I believe I've said enough on all this. Okay, somebody asked me. There's another question somebody asked me here. Somebody, I don't know. Okay, do we have another question? I'm trying to see if there's another question, but I'm not seeing any question here. I promise. Somebody asked. Okay, yeah, I promise. I think Joe. She was the first person that asked me a question about food, about the food she can eat as a diabetic, and I did reply, respond to her that we're not talking about food on this. This is a different topic. Um, so I did not. I refer her to go and watch my videos on my page. There are videos on dieting. So I'm going to use about 2 minutes to answer her question on the, because I did promise towards the end of the program, and if I have more time, I will answer her question. Now, if you're diabetic, there are food that you can eat and there are food that you cannot eat. Okay, I believe Joe, I don't know if you are still listening, if you are still with me. If you're diabetic, all right, you have to reduce your carbohydrate intake. I never said do not take carbohydrate. As a diabetic, okay, you need carbohydrate to survive. That carbohydrate provides you the energy that you need, but you have to reduce your carbohydrate intake by counting your carbs. You need to eat more of fiber food if you're diabetics. A lot of fruit and vegetables, okay? A lot of fruit and vegetables and proteins, okay, is what you need more than carbohydrate food. Carbohydrate have to be reduced to a minimum. So you have to eat in a smaller portions every day. You don't eat in a larger quantity because the more large your food is, the higher the carbohydrate, and it's going to affect your sugar level. So you have to eat in a smaller quantity every 3 to 4 hours. You eat, and per meal, you must have 15 grams of carbohydrate per meal. In a day, you need about 60 to 65 grams of carbohydrate in your daily foods. You must not exceed 60 to 65 carbs a day. So the foods you have to eat is food that are rich in fiber, less carbohydrate, like brown rice, brown bread, fruit, a lot of fruits, vegetables, spinach. You know what is called vegetables. Okay, you need more vegetables. I don't need to specify them. You know what is called vegetables, fruits, legumes, lentils, all those things. You need them more. Okay, and then a little bit of carbohydrate in it. Instead of you eating all those corn meal, cassava meal, yam, okay, all those meals that are starchy carbohydrate, you stay away from all those kinds of things and go for grains, either whole wheat or whole grains. Oatmeals, those are rich in fiber. That is what you need. You have to stop eating all those corn meal, cassava meal, mealie meals, semolina. All those things are starchy carbohydrate. They are very, very high in carbs, and they're going to spike up your sugar level once they are broken down into glucose. So instead of that, go for grains, whole wheat, oatmeals. Those are rich in fiber with less carbohydrate. Still, you have to consume them in moderation. In a smaller quantities is what you have to consume. But most importantly, a lot of vegetables and fruit is what you need. Okay, and then reduce your carbohydrate intake and more exercises. If you need more exercises also, and then reduce your weight. So these are, how to manage your sugar level, and these are some of the foods you have to eat. That's why I said, go to my page. You go to my page, select the video, take your time and watch it. For me here, see, it will only take me 1 minute to answer your question. You might not even get the full answer because I'm not going to start listing all the kinds of food. No, I'm not going to do that. Okay, that's why I refer you to my page. You go there, videos for dieting. You can, at your own time, take your time, watch it. And there we listed all the kinds of food you can eat and things you cannot avoid to eat. So that's why I refer her to go and watch the video. For me, I'm not going to sit here and be telling you, listing all the foods you eat. No, it's not possible. We'll have a video for it. So if you're interested, you have to go to the page and watch the video. There, you have your time. The foods are listed there and give you more insight on what to do. So, Joe, I believe this little intro will be helpful for you. All right. Let's go to this question. Bob is asking me how sex in men contribute to more kidney problem relative to women. Okay. It's like Bobo is like, you like sex so much because this is the second time I saw the first question. I tried to avoid it, but you asked again. It's like you like sex so much. Okay, I'm going to give you this. I'm going to give you the sad news. All right. All right. Why? Yes, we did mention it in your kidney situations that is more prevalent in men than in women. Okay. Yes, how does sex contribute to kidney? I did not say, we did not say, I hope you got it wrong. I did not say sex contribute. That is not what I said. So let's correct that. We are talking about the risk factors. Okay? Risk factors that can increase the chances of you having so we're talking about the risk factors, okay, that can make you to have kidney damage. All right, we talk about the risk factors that can contribute. You're right, contribute to the complication of kidney disease and diabetes. And we mentioned about smoking, age, sex, health conditions. Okay. Now, when we talk about sex, okay, people with kidney disease, okay, or kidney failure still enjoy sex. But when we talk about the risk factors of sex when we talk about risk factors you face while having kidney disease, okay, and I say it's more prevalent in men than in women, is that sex have to do with emotions, okay? Sex have to do with your nerves, your blood vessels have to be intact. Now, if you have kidney problem or kidney disease, your interest in sex may change when you have those conditions, okay? At first, you might lose interest in it. This can happen because you need a lot of energy to cope with the physical and emotional aspect of it, okay? In time, the interest may return to normal. But one thing you have to know is that as a diabetic, what causes you to have sexual problem is as a result of your diabetes. Okay? Remember, what causes you to have sexual malfunction or ELD is a result of uncontrolled diabetes. Now, uncontrolled diabetes is as a result. If you are not controlling your diabetic situation, it's going to lead you to have kidney disease. These are the complications. And if you are still not yet controlling your kidney disease, it's going to help also lead you to have kidney neuropathy. Okay? Nephropathy, which is kidney damage. And that kidney damage is as a result of the complications of diabetes that lead you to have kidney disease. So that is why we are telling you that these are the linkage between kidney nephropathy to diabetes. Now, if you have uncontrolled diabetic situation, it's going to lead you to have kidney disease, lead you to have kidney damage. Another word for that kidney disease is going to lead you to have diabetic nephropathy, which is the kidney damage. And what are the risk factors of kidney? That kidney damage is sex, because it's also as a complications of diabetics. When you have uncontrolled sugar level, your nerves are going to be destroyed. There's no blood vessels flowing into those areas, those sexual organs. The hormones are going to be lower. That's why you see you have your ELD, no erection, or erection is going to last fewer than normal. So we are talking about the complications that arise from your diabetes to kidney disease to kidney damage, and sex also plays a vital role in leading you to have those kidney complications. Because now, just imagine somebody that has a kidney problem. You might have loss of interest. And again, also, you don't want to worsen the situation, because you don't want to worsen the situation because you need that physical energy. The more you engage in physical activities while you're having the kidney problems, the more there are pains. And that pain may put a lot of stress on your kidney. And that is why you see most people that are having kidney problem do not enjoy sex anymore. They don't have that physical energy because you need that physical and emotional energy to be able to enjoy sex. And anything that is going to put pressure on that kidney, you avoid it. So that is why I say sex also is a risk factor of worsening the situation of your kidney problem, because the more you engage in that physical activity, there will be pain. You might not even enjoy it because the pain is there. Okay, the emotional, the enjoyment is not going to be there. Rather, what you are causing is that you are causing more, putting more pressure, stress on your kidney that is not functioning properly. So that is why they say sex contributes as a risk factor of your kidney problem. So you see, most people that are in that situation, I haven't seen somebody that is having it in stage 4, stage 5 that talks about sex anymore, because you wouldn't have that energy. You wouldn't even think about it because your kidney is not functioning properly. Anything that is going to put stress on that kidney, you are going to avoid it. So that's why sex is classified as a risk factor of a complication or contributing factor or worsening your situation of kidney damage. Because everything, both your kidney damage, your kidney disease, all linked to diabetics. Because you are not controlling your sugar level, it leads you to have kidney disease, and you still not yet control the root cause of your kidney disease, it metamorphoses to kidney damage. And what are the risk factors? What are the contributing risk factors that is going to worsen that situation to end it to the end stage? They listed several things, including sex, age, smoking. Because continuous sex while you are having that in the state of kidney damage is going to worsen the situation. So that is why you have to stay away from sex at that particular point in time until your kidney is functioning properly. You do not want anything to put stress onto that kidney. So anything that's going to add additional stress to that kidney, you stay away. Sex is a contributing factor for that kidney damage because it's going to put a lot of stress into that organ. Bob, have I answered your question? I have something for you to read. I'm going to put it there for you now. I want you guys, Bob, I want you guys to read that. All right, do we have any more questions? Do we have any more questions before we call it a day? Because we are at the end of our... Do we have more questions? If not, we're going to call it... We are here 2 hours now. So if we don't have any more questions, we're going to call it a day. Let me see if there's going to be any other question. All right. So if no any other question, I'm going to let you guys go so I can go and enjoy my Saturday. All right. If no any other question, I'm going to call it a day so I can go and wait to read your comments. And wait to read all your comments. That's what I'm going to do now and wait to read all your comments. Regina, thank you. Regina, you're welcome. Thanks a lot. All right. Anything that has a beginning has an end. So this is 2 hours, 5 minutes we've been having this program now. So Regina says, my left arm is painful. What? If your left arm is, you see, your left arm is painful does not necessarily mean anything, because it could be the way you slept last night. Maybe you slept wrongly, and then your arm, sometimes the way you slept. Haji, you're welcome. Thank you very much. So sometimes the way you sleep, sometimes, when you sleep wrongly, sometimes, there's sometimes you sleep, you got up in the morning, you start feeling pain in your neck. Yes. Sometimes if you sleep wrongly and there is no, because your blood supposed to be circulating all part of your body. Okay. So the way you sleep at night might make it impossible for blood to flow. Okay. There's a blockage in the arteries, the blood vessels, so blood could not flow. So it forms a blood clot. Okay, because the way you slept. So when you get up in the morning, you start feeling those pain. It's going to take some time for that blood clot to melt and your veins, your arteries stretching up. And then once the blood starts flowing, you see the pain disappear. So for now, because your left arm is paining, it's nothing. Okay, so just let it be. Just take a painkiller. Take a painkiller. Okay, and see what. If the pain persists for 7 days, then okay, it's a serious pain that you have to go and see your doctor. Not just because you wake up in the morning and you're feeling your arm is painful, then you are concerned. No, just take a painkiller. All right. Try to exercise, move that arm. Just try to move that arm around, exercise that arm, and keep an eye on it for 1 day, 2 day, 3 day. If that pain persists or worsen, then it becomes a concern. You have to consult your doctor. But for now, it's nothing. So I wouldn't take it as something serious. All right. Regina, I believe you're okay. I hope you're going to get better. All right. So that is it. So I'm going to let you guys go and enjoy your weekend, enjoy your Saturday afternoon, evening, depending where you are. For me, I'm just going to go and find something to eat, relax, and then go through your comments that are coming in, answer the question that I will answer. And then tomorrow is another day. We're going to have another program tomorrow. Keep watching the videos. Keep watching the videos from the beginning to the end. Keep watching the videos from the beginning to the end. So give us a thumbs up and share it to your friends. So once again, I will thank all of you that have joined this program today, have contributed to this program today, have asked their questions. Thank you guys. And for those that are watching me behind the scene, I say keep watching, and then we're going to meet. Yes, Regina, stretch your arm. Stretch your arm. It's nothing serious for now. Stretch your arm and then take a painkiller. All right. And if it persists by Wednesday, then Thursday, then it's another thing entirely. All right. So friends, go and enjoy your weekend, your Saturday evening, afternoon, or morning, wherever you are. We're going to meet tomorrow again for another live session. We're going to have a session. And then I'm still waiting for the person that is going to join me on the live program. Since you guys have the link, okay, I'm still waiting for the first person who is going to come on live and share their diabetes experience. Share their life experience living with diabetes. I'm still waiting for the person who is going to come on live video to have a live session with me and then share the live experience. So I've given you guys the link. You can save the link on your phone permanently, then open it permanently. Anytime I'm live, you can use the link to join live. So once again, I'm going to see you guys sometime tomorrow for another program. Stay blessed and have a wonderful day, evening, or afternoon. I love you guys. Bye-bye.